This is the 6th annual Health Innovation Summit that GlobalSTL has hosted. What's special about this year is it's very laser focused on an urgent issue that all of our partners told us this is the issue for 2022. We need to solve the workforce crisis in our healthcare institutions.
Our goal is to meet other folks who are also intrigued in solving the problem, especially from a health equity perspective.
People are looking very practically at the challenges that we have in the care environment and trying to strategically solve that with creativity and innovation and some form of technology.
The summit provides a great medium to have a conversation with people that are on the ground engaging with patients and providers.
And we all were on the similar mission, the mission being how might we in our respective roles glean from the summit topics and presenters, things that have already been tested and tried so that we don't have to overly reinvent the wheel as we try some of these tactics on our own.
What we can do is treat people differently. We can get better labor strategies and shift schedules. We can actually give them access to information so they can make better decisions faster. It's about thinking differently, engaging the workforce in a real and meaningful way, and empowering them.
We've identified 5 solution spaces that we've heard from our healthcare organizations are the big ones. One is, how do I build an on-demand workforce? The second is, how do I recruit my workforce when everybody else wants that same workforce? The third is retention. You've got the workforce, they are quitting in masses, why? The fourth is, you've got your full-time workforce, you've got your on-demand workforce, how do you make this thing work like a well-oiled machine? And the fifth one is the biggest one. You have to completely rethink your clinical, operational, financial model. Healthcare will never be able to get the workforce that it needs to deliver its mission. It won't happen.
St. Louis is a hub of healthcare innovation. We have the good synergy of health system executives that are national leaders with bringing in technology companies here that hopefully will invest in St. Louis, but also bring the two together to spur this innovation and create a revolution in healthcare.
ShiftMed is an end-to-end workforce partner. We have the #1 nursing job app across America. In just St. Louis, we have over 5,000 W-2 employees that where we observe that a need's not going to be filled internally, we help to fill that with a local resource. We have an exciting integration and partnership with Uber Health that even enables you to go there for free.
EMTs and paramedics are some of the most widely available yet underutilized resources in all of healthcare. MedArrive, what we do is we power entire care programs. We bring telehealth into the home. We help them get access to DME, food, meals, transportation.
The character everyone knows as Wobot is a virtual mental health ally. What it does is it makes available to any user that needs mental health support, easily accessible on your phone, anytime. It forms a human social connection with an individual.
We are flexible, we are customer-centric, we listen to what our healthcare organizations are looking for, and then custom build the summit to deliver what they're looking for.
GlobalSTL is a phenomenal partner. I think this is really something that is very beneficial when we think about being able to come together and generate a think tank around deployment strategies and really truly building an ecosystem.
GlobalSTL, the partnership that we value is the fact that they deeply understand what our crisis is, the healthcare staffing crisis. They researched and they went out and they understand the different solutions that are available and brought forth the best ones.
You guys know how to convene thought leaders. When I think about how we can transform Missouri Medicaid, it is a very target-rich environment for transformation. There's a lot of change that needs to happen, and we need to have access to the thought leadership that are at events like this.
GlobalSTL is an amazing partner for the region. It brings folks from other areas beyond our borders in St. Louis to help us think through what are best practices or opportunities for innovation and rethinking what we have, but it's also an opportunity for us to share what we do great here.
Because of these convenings and this collaboration that GlobalSTL has facilitated, St. Louis is becoming an epicenter for solving some of the most pressing issues facing our healthcare economy.